On March 4th, 1909 in Ontario, Dr. Henry J. Breault was born. He was a Canadian doctor and medical researcher who was instrumental in the creation of the first child-proof container. After studying at Western University in London, Ontario, Dr. Breault received his MD in 1936. After the completion of his medical degree, Henry decided to pack up his bags and head west 2 hours to Windsor, Ontario. In Windsor, Dr. Breault had an internship at Hotel du Hospital. His internship at this hospital allowed for him to get a strong foundation in pediatrics. In 1957, Dr. Breault became chief of pediatrics and director of a new poison control center at the Hotel du Hospital. He was faced daily with cases of children poisoned by medicines or other hazardous products found in the home, especially the aspirin bottles, which could be easily opened.
At the time that he developed the safety cap, childhood poisonings were very common. There were approximately 100,000 cases of childhood poisonings in Canada a year, with about 100 deaths.
Dr. Breault went against odds in focusing his efforts on prevention and protection rather than the typical approach of attempting to cure the problem once it had already surfaced. In doing so, he encountered numerous failed attempts on finding an appropriate solution. However, despite his frustration, he continued searching. After an aggressive public education program failed to lower the incidence, Dr. Breault focused furthermore on prevention and protection by facilitating the development of the first child-proof container.
In 1962, he established the Ontario Association for the Control of Accidental Poisoning and then worked together with local physicians and pharmacists to put an end to these unnecessary childhood deaths.
At 3 o'clock in the morning, he's out, he comes home and he said, I've had it. I am tired of pumping children's stomachs when they're taking pills that they shouldn't be having. He said, I've got to do something about it.
And he realized that the education part of it wasn't really the good part. You had to have protection. And how do you protect a 2-year-old child from opening a bottle and tasting it?
Peter Hedgewick, president of ITL Industries in Windsor, was enlisted by Dr. Breault to create the first child-resistant safety cap for prescription bottles. What we now know as the palm and turn method for opening prescription bottles was developed and adopted in the Windsor area in 1967.
The amount of child poisonings quickly dropped by 91%. The Ontario College of Pharmacy endorsed the new cap, and it was soon in use across the province.
It was a lot of work, but it was the joy of seeing it accomplished was a great thing.
The Ontario government made childproof containers mandatory by 1974. Other provinces soon followed, as did the United States. With the help from Mr. Hedgewick, Dr. Breault's prevention was now going worldwide. Henry's childproof container idea has saved countless children from death or serious injury from accidental poisonings. Placing such a big impact on so many people's lives, a health official put, "The child-resistant container is to childhood poisoning what the Salk vaccine is to polio." As he later died in 1983, his legacy lived on. He was remembered for his passion and hard work for prevention and safety of children. In honor of his career, passion, and hard efforts, the Hotel du Hospital in Windsor established the Henry J. Breault Pediatric Center. Dr. Breault's brilliant idea continues to change and save the lives of many children and families.